So I've got a patient here with a really painful corn on their foot. Now this one's particularly interesting because it's not in a really high weight bearing area. But if you know the anatomy of the foot, there is a little bony prominence in there that may be pinching the skin between the ground and the bone. So this one doesn't have a really large callus cap. It's mostly corn, so it's really, really painful. So we remove what little callus cap was there, and you can see the really defined central section of the corn there now that we need to go and remove that out. So we're using a 15 blade, just making sure we get as much of that callus cap off as we can, so we get a really good look at the borders of where the corn is. And you can see really clearly there that central section of the corn. So I'll try and get that out and show it to you, just what it looks like when we core that one out. So again, very carefully just going around the living and the dead tissue border here, making sure that we don't take too much or too little, and it will hopefully just pop out for us, and we'll be able to give this patient some instant relief. Now, we've done this one a few times before. We do this about every 8 to 10 weeks for this patient, and the relief is immediate. We've changed her shoes, we've got her using moisturizer, but we think it's because the fatty pad in her foot is just worn out in this location due to her sort of bony, knobbly foot, and it's causing the pressure on the skin here. So we're just going gently move this one out, because again, this one's really a painful corn. So we don't want to cause too much pressure on that. So we just really gently go around those edges, make sure we corn that out, and see if we can catch it here without dropping it on the floor. All right, so this is what it looks like. So that's just a really, if you can see that one there, it's got this really dense piece of hard skin. It's like a compressed piece of skin. No blood vessels, no nerves, so that's why there's no pain or there's no blood. We'll just drop that one on the ground there. And so then we go ahead and just basically smooth down those edges, sand it smooth with our little rotary sander, and then we'll review this one. We'll probably go a little bit less than 8 weeks this time to try and improve the situation, but then 8 weekly treatments after that.